Well, good morning, Jagendra Rana here. Common disorder without common symptoms. What is lean PCOs? This is the topic of our discussion today. Common disorder without common symptoms. What is lean PCOs? Association with body weight makes ovarian disorder widely misunderstood and often undiagnosed. A girl, Priya, a student from Hyderabad, had her first period at 12, but her menses were never regular. Over the years, gaps between her periods grew wider, sometimes 3 months, sometimes up to 6. At 16, painful acne dotting her cheeks and fine hair on her upper lip and chin made her realize something was not quite right. So a visit to the gynecologist and a set of hormonal tests diagnosed her with polycystic ovary syndromes, that is called PCOs. Polycystic ovary syndrome. Now, what surprised her parents was that Priya was neither overweight nor inactive, both commonly associated with the hormonal disorder that affects ovarian functions. She played badminton regularly, ate home cooked meals, and Priya was lean. So it's a common myth that only overweight girls get PCOs. Up to 20 to 30% of PCOS patients are lean. These girls are often missed as they don't fit the typical overweight PCOS image, even with normal BMI. They can have irregular periods, acne, excess hair growth, and insulin resistance. PCOS affects girls of all body types and socioeconomic backgrounds. A condition stereotyped. How? For decades, Indian understanding of PCOS has revolved around obesity combined with infertility and insulin resistance. But newer research is showing that this stereotype is narrow and misleading. So, a 2023 study from Gujarat, published in an international journal of reproduction contraceptions, obstetrics and gynecology, found that lean women with PCOS, BMI below 23, normal range for Asians, had the same hormonal disruptions as their heavier counterparts, including higher levels of luteinizing hormone and testosterone, both responsible for regulating ovulation and sexual traits. So an earlier study from Mumbai that tracked 106 adults and girls found 61% of those with PCOS were lean, yet showed a higher visceral adiposity index, that is measure of fat around internal organs, and other metafat around internal organs, and other metabolic risk markers than girls without PCOS. Doctors at national president of the who is national president of the Federation of Obstetrics and Gynecological Society of India, says, unfortunately in India, any woman who is obese and has regular periods is hastily labeled as having PCOS, but obesity and irregular cycles alone do not confirm the conditions. She recalls how in the last decade she has had many young women walking into her clinic saying that they have PCOS because someone told them So till tests reveal otherwise. So check the hormones first. That is why a careful clinical assessment is vital. Diagnosis should be based on the symptoms and hormonal tests, not ultrasound alone. As ovarian cyst visible on the USGs of adolescents can sometimes be normal. It's also a myth that PCOS means that you can get pregnant. Many women conceive naturally or with the proper treatment. But PCOS cannot be diagnosed right after the first period or menarche, as cycles often takes 2 to 3 years to regularize naturally. While doctor cautions against overdiagnosis, she says lean PCOS often goes unnoticed unless symptoms like acne or facial hair appear. Metabolic issues like insulin resistance, high cholesterol, and hidden abdominal fat can still be present. So hormonal changes during adolescence already makes this period emotionally turbulent. PCOS adds to the turmoil. We see young girls struggling with the mood swing and anxiety and body image issues owing to acne or body hair. This can lead to anxiety or even depression. It is important to address the emotional and behavioral aspects of treatment as well. So beware of trigger factors. Exposures to endocrine disrupting chemicals in plastics, cosmetics, and processed foods are quietly adding to the PCOS risk. Several studies shows women with PCOS have higher level of chemicals such as bisphenol, a BPA, phthalates, and FPAs in their blood. So says environmental scientists, these can mimic or block natural hormones, disrupting estrogen, androgen, and insulin regulations. The evidence is compelling, though we need stronger research in India. Doctor says girl with less than 8 menstrual cycles annually or a period gap longer than 90 days, even a year after marriage, should be screened for PCOS. Pediatric surgeons at hospitals suggest a pre-PCOS stage to identify those at risk early. Much like pre-diabetes, this would help reduce psychological stress while shifting focus to timely lifestyle change such as regular physical activity, avoiding processed food, and eating plenty of fruits and vegetables. The epigenetics, or how the environmental influences our genes even before birth, plays a major role. Ensuring good metabolic health in young women today will not just protect them but also their future kids. Future kids from the rising burden of PCOS. So we need to stop seeing PCOS as just a weight issue. It's a hormonal and metabolic spectrum, and at one end of it are thousands of adolescents and young girls who need to be seen, heard, and treated fairly. Thank you. Thank you very much.